the second time.
Yeah.
You understand me? So that's basically what the physiotherapy can continue as well.
Ichuku Jacob, doctor, my mom is suffering loss of memory, showing signs similar to what I read to be signs of Alzheimer. Is it
Dementia?
Yeah. So you said it's disturbed. I sent you a message on WhatsApp and Facebook. Okay, but that's not. But what do you think could be?
Yeah, it is actually a form of autoimmune illness that the brain is aging, all right, and unfortunately maybe aging faster than expected. So such happen. Small therapies can also be given and all that, but the much is managed as you see it.
All right, let's go back to the phone lines. 95.1 FM. What's your name? Where are you calling in from?
Hello, Canada.
Good morning to you.
The question to what I had, I wanted to say, how the doctor, what should be done? I see the marriage now. What should be done in that very case?
I said to go to another question. There's little anybody can do on it. Just continue the physiotherapy and pray to God. He is a God of all flesh. Nothing is impossible for him at this point. Okay.
95.1 FM. What's your name? Where are you calling in from?
Hello, Canada.
Good morning.
I'm calling from Ovivo. My name is Sonny.
Sonny, welcome.
Yes, if somebody has glaucoma, is there any tendency of him having this thing? So,
No, there are two different things. Glaucoma is a problem of the eye. Ultimately, it will damage the optic nerve, so the person it causes irreversible blindness. So that's why any glaucoma patient should be able to prevent the pressure, but it has no bearing with a stroke. It's not hypertensive; it's hypertension of the eye exclusively.
Okay. 95.1 FM. What's your name?
Good morning.
Good morning to you. What's your name?
My name is Emmanuel. Doctor, good morning.
Good morning. Welcome.
I want to ask a question. Somebody that was stroke by the age of 58.
I didn't get that question. Come again.
I said that somebody was stroke at the age of 58.
Can somebody get stroke at the age of 50 years? Is that what you're asking?
Yeah, it's not age related. It's just all the factors we talk. It's an accident. So whenever any of these factors we mention misses road, there are people that are very hypertensive. Recently I met a young man almost in the age of 30 with a BP of 180 or 120. So because he also the father, the mother, in fact, he made mention that all the people in the mother side, they all died of stroke.
Of stroke.
Yeah, so it's something that sometimes it's not age related in this way.
All right. Sarah Mara Abimbola, mine is, I don't get this message though. I said mine is immoral stroke. Is that immoral stroke? Or is she meaning immobile stroke? I don't get.
Let the person come.
Please send your message again if you can hear me, or if you're watching live on Facebook. What do you mean by immoral stroke, please? All right, back to the phone lines. 95.1 FM. What's your name? Where are you calling in from?
Okay, my name is Grace. I'm calling from Bible.
Your name is?
Wait.
Welcome.
Okay, that's what I want to know. In ladies, at the beginning, you need to have the both breasts to be equal, but before you could know one is getting lesser. Is that something one can do for the other one is getting small to get the baby?
You're talking about the what?
The breast size. Usually the breast size. One usually basically the left side tend to come down a little than the distance, but if it is absolutely of discrepancy, when the one is fully developed and the other one, there are a lot of things they talk about which I've not been able to get the right result in that.
Okay.
All right, thank you very much for calling in. 95.1 FM, what's your name? Where are you calling in from?
My name is
climb on people.
Welcome.
Thank you. There's a question I want to ask. It's based on a health-related matter, but it's not on the topic we discussed today. The question I want to ask is that my woman is having sometimes when we're having sexual intercourse, there's some white substance that will be seen from her private part. So I want to ask, could this be an issue of infection, or there's nothing wrong, or is it a normal thing?
While it is not our today's subject, and since you have been given opportunity to discuss that, depending on usually lubrication happens during the intercourse, and some women have more lubrication than the other, so that very whitish foam doesn't actually be a problem, and it does not always occur. On the other hand, if it is a problem that causes itching also, it may be as a result of candidiasis, which can be treated.
All right. Thank you very much for calling in. There's a question on Facebook. Oluwaseun Adebe says, how do we solve sarcoidosis heart attack? I don't think I pronounced that.
Heart attack.
I think she said, or the person said heart attack, but there's a name the person put in front. Sarcoidosis.
Missing out two differences.
Oh, really?
Yeah, missing out two differences. But the issue is that let him come clearer so that we'll be able to communicate to our people.
All right then.
It will be heart attack and sarcoidosis completely
two different things.
Yeah,
all right then. Morning, Canada. Doctor, I attend to these three medical conditions. 1, I pant when I climb a stairs or up a stairs, and was to a point of collapsing when situations force me to suddenly run. I don't sleep well when I eat late from 8 p.m. leading to fluid retention under my eyes in the morning with darkened color. 3, how often should one take Vasporine or aspirin to prevent stroke? Thank you. Evans is asking.
Yeah, the issue is that my people say that when they tell a tree that we kill you, he will remain there. But when they tell a man that you are dying, he will pick race.
Yeah.
You understand me? Yeah. So he can't be at home and be talking about it. He needs complete health, cardiac evaluation. In fact, it's a matter of complete health. That's why I say people should go for complete health check. A lot of things are going wrong and people are just managing it. He's feeling like this. He's still struggling to go.
Like you mentioned earlier.
Yes, he may have money now. He will be looking for land where he will buy.
Or looking for where to enjoy himself.
Yeah, that's what I mean. But it's unfortunate that, my friend, move right now, get to the hospital and be comprehensively evaluated. Thank God that ultimately the issue of cath lab, which has been the 4 digital cath lab, is in Port Harcourt right now. So it has also given the opportunity that extreme heart related problems can be solved.
Right.
So, but one should not be in position to remain there until the death do the person part.
All right. Okay, I think Saramara Bimbola has she has replied.
Permit me to also, he's talking about Vasoprene. Vasoprene is not a treatment. So that doctor gave you Vasoprene some time ago does not mean you know the drugs doctor is giving to you. Anybody with heart problem, as a matter of fact, for having a heart problem, there are a lot of drugs that are contraindicated for somebody having a heart problem. So if you see the drug doctor gave you before and you are taking it, you can kill yourself just on the course of taking the same drug.
Right.
And there are a lot of drugs that are conventionally, even on the issue of painkillers, that somebody that with heart problem should not be in position to take. So I advise you to straightway go to the hospital and let the doctor attend to you.
I think the woman who was talking about the stroke, she said it's hemorrhagic stroke. I don't. She said. So how?
Hemorrhagic. We've been able to talk about that. Hemorrhagic stroke is the one bleeding with a bleeding tendency. All right. So as earlier said, the presentation and at the point of presentation also matter a lot in the outcome of it. It's usually the one that kill more.
No, she's asking, can she still take the injection you were talking about?
No, it's not meant for hemorrhagic. That is a bleeding tendency.
All right.
And it's not just that after many years you say give me the injection. It's a time dependent thing. on the cause before the brain damage occurs.
All right then. Good morning, Canada and Dr. Okoye. Please, doctor, my mother-in-law had stroke some years back and it was cured, but she has always complained, or she's always complaining of pains. What could be the cause? Thanks. This is from WhatsApp.
Yeah, calling about the pains, actually, other things can be evaluated. That somebody suffers stroke does not mean that other things cannot happen. All right, but as earlier said, prevention, it's an affliction shall not happen the second time. That is to say, you expected to know why the first one happened. Otherwise, affliction can happen over and over again. So to avoid the repeat stroke, you need to be fully taken care of. And if it is pain now originating from elsewhere, attention can be given to that also.
Mavis Movi is saying, I sometimes have this heart palpitation which leads to fluid vision, shortness of breath, and my neck. I didn't get that part. You said my neck and head beats at the same.
It's obvious that he has a heart problem. There's no issues about
but the person said he has gone to the hospital. I've done some tests, but it continues. I noticed it attacks me more when I don't sleep well the previous night. They said my heart is okay. Please, do you have a name for the condition?
It's not what we're going to talk about. He needs to have a second opinion. When people say, I've gone to investigation, I've gone to do tests, and you ask me, go to one lab. There are a lot of things that could be done. We talk about this very person, as the ECG is there, the echocardiogram is there, the stress ECG is there. You have the pulmonary function that you have the 24 hours ECG monitoring, because that's why people that have atrial fibrillation can sleep and may pass out from there, and it says it's an attack. Also, the aspect that has to do with angiogram to trace if there is a blockage of the blood vessel, and if there is, you can do angioplasty. So all extreme things are right there in the half for proper evaluation.
Itowo F. Young says, please, sir, my father is suffering from heart failure. He's taking medication, but still has swollen legs and stomach and belly. The person is asking for help. How do you help such a person?
The interesting thing is that heart failure can be a person of heart failure who has come to a point. That's what is called ejection fraction. Ejection fraction in the sense that it is the capacity of the heart to pump our blood. All right? And this blood should be enough, but when the blood pumping out is less, usually in a situation where it's less than 35% of ejection fraction release, the person will definitely be getting so tired, they may not be able to do anything. At that point, this very person will benefit from what is called biventricular pacemaker. That biventricular pacemaker is something that will be placed in the heart. It will be helping to contract the heart, because at this point, the heart of the dad's heart is not contracting again. It's not just like somebody that's supposed to pump very well, in order to pump out, it's pumping. So more blood will be inside the heart. You see, the heart will become more enlarged and very, very weak. So at the point of such weakness, this person may benefit from what is called biventricular pacemaker. Even though it's expensive, but it can be life-saving. That the value of a man in his home is a moral booster to the children. So for which attention should be given to life.
Felix Inigruta is asking the question. I have partial stroke. I believe that's what he meant to say. For over 2 years now, I went to bed and woke up and cannot talk. He's asking for explanations. I think it's what we talked about when we said, if the left side of the brain is affected, then the right part of the body does not work properly. I want to believe that's what they refer to partial stroke.
Yes.
All right then. Felix, I think we've explained that. Now you get it. Let's move to the next message on WhatsApp. This one says, good morning, Today FM. I want to ask, why is it that if someone has stroke, I think we've answered this one too, it only affects one side of the body from up till down, like right hand and right leg, or left hand and left leg. It doesn't affect all parts at the same time. I want to understand why. And doctor explained earlier that the reason is because there are two sides to the brain, two hemispheres, and the left and the right side, and the right side controls the left part of the body, while the left part of the brain controls the right part of the body. So if the depending on the kind of stroke, because we have two types of stroke, if the left side of the brain is damaged or affected, then it means that the right part of the body. I feel like a doctor.
You did
right
class.
now. I feel like a doctor right now. I'm going to take some more calls. 95.1 FM.
Hello.
Good morning.
Good morning. Yes, my name is Elvis. I'm calling from Port Harcourt.
Elvis from Port Harcourt, welcome.
Yes. Okay, so please, doctor, sometimes I do have this sharp pain in my chest. Now, when it comes, I have to maybe hold my breath for a few seconds. At least, it has just for a few seconds. But I have it in my right side sometimes, in my left side sometimes. I've been to the hospital, I've spoken to a doctor, and the doctor said it's not a concern, that it happens to some people. But it comes occasionally, it's very sharp, that I have to hold my breath so that the pain doesn't increase further, because I feel if I breathe, it increases. So that is just the problem I've been having for, I'm just 28, so I've been there for like some years now.
Yeah, you know, when it has to do with this very subject, I don't usually sweep anything under the carpet.
All right.
Seek for second opinion. In the matter of 2 or 3 witnesses, a matter can be established. You know, so when you have such positive, good result round and about, it gives you the opportunity also to be more stable.
All right. So you should seek for second opinion and do some more testing, ECG, right? And
Yeah, that's why I say you should seek for second opinion.
All right,
A lot
then.
can be done.
All right then. Let's take some more calls. 95 or lost that one to call back in. 95.1 FM. What's your name? Where are you calling in from?
I'm Friday calling from Port Harcourt. Good day, sir.
Friday, welcome. Talk to me.
I want to ask, sir, is this stroke the same thing with Parkinson? Or if there's any difference, what is the cause of Parkinson? And does it have a cure for now?
Okay, the Parkinson disease is a different ball game. You know, that has to do with the neuron, that's with the brain cell and the motor neuron. Yes, it makes the person like to initiate movement is a problem. Just
So the parts that deals with
it's
movement.
a brain related thing also. So
Okay.
but that can be managed, you know, conservatively.
All right.
Based on some of the drugs are available for it. So it is not same as stroke, it's a different ballgame. But such a person can say a stroke can still be superimposed on that existing Parkinson disease.
Somebody is asking if you can talk about the management of a stroke patient, you know,
In the hospital setting.
No, at the home level. You know, after you know, for instance, let's say the person goes to the hospital after the 4.5 hours timeline that we talked about, and let's assume it is
after being discharged, why will you?
Yeah,
it's still on that management in terms of you know, caring, you know, because of course the person at that point, it's a multi-disciplinary kind of approach, because a man who used to be quite active trying to help out his family all of a sudden is incapacitated, you know, depression will also come in.
Right.
You get that? So, and also the aspect that has to do with the issue of physiotherapy, which is by reason of physiotherapy protocol, you can be asked to do this, do that.
Right.
Yes, I mean, and psychological support. The person who is also taking care of a stroke patient needs also another person to also support him.
Take care of him. All right.
It's a complex issue.
This one is saying, good morning, doctor. Sir, I masturbate frequently, and after the act, I feel chest pain and difficult in breathing. Is wondering if there's a relationship, if there's a heart failure somewhere or heart attack or something.
Yeah, the issue about it, God said, if your hand will lead you to hell, make you cut and throw away. So what are we talking about?
Oh my goodness.
But if that one is the one that is, you know, is causing you a problem, cut it.
But you know, I don't know. I'm wondering, is there the
truth of the matter is that you know, some people, we've talked here before, why some people die during sexual intercourse.
Yeah, something like that.
Yes, it's a very critical thing that happened, because the during ejaculation, All right. During ejaculation, because of the sympathetic nervous system that control ejaculation, also controls the heart. So during ejaculation, the heart will stop working. All right. So that's why after ejaculation, a person should be, the body system should return to normal. But when it happened in a situation, most of those people that died, they died on top. They died in a hotel because he may have tried to do turnover of a return on investment.
Oh my goodness.
You know, so on the cost of return of investment, on trying to call this, for those of them that have heart-related problems, that's why most of those aphrodisiac drugs, you know, because phosphodiesterase inhibitors, or this Viagra and all that, they don't protect the heart. So most of those things people consume may end up killing them in the course of saying I must win the Olympic game,
and they win from the other side. All right, let's go back to the phone line. Lost that call. 95.1 FM. What's your name? Where are you calling in from?
Good morning, sir. Good morning, doctor.
Good morning to you. Your name, your location, and your question.
My name is Dr. I'm calling from Port Harcourt.
Welcome.
Please, my nephew of 19 years, he always, once in a while, he experiences a fall in the bathroom. Each time he wakes up to urinate in the bathroom early in the morning, he will experience a fall, and then during the fall, he will lose consciousness. He will wake up with bruises, and most of the time, no one is around to see when it's happening. The last one that happened to him happened last week, and we're all surprised. He fell down, and then he was shaking, he lost consciousness. After some minutes, he woke up. We've gone to the hospital. So once, they said nothing is wrong with him. I really don't know. Is it related to heart attack? Is it related to...
Yeah, I would suggest, I always ask, there's nothing wrong for second opinion. You know, that's why sometimes you see one thing will happen, somebody will say, let me have it. So even a doctor may be not so comfortable with his diagnosis, he may send you
to another, he may refer you to another hospital.
Yes, can you be in position to look at it? But they also will be able to rule out a kind of epileptic kind of a seizure where may be triggered by the particular kind of act and all those kinds of things. But before then, I will be in position to suggest a second opinion in that regard.
All right. Can you please explain what the ECG is? Because someone is thinking it's a disease.
ECG is electrocardiogram. It is one thing that they plug on your heart and all that to look at the electrical activity, because the heart has the electrical dimension and plumbing dimension. The plumbing is aspect of the vessels supplying the heart. Then the electrical activity, the heart initiates its own. You know, the heart initiates its own activity. When I say that, for you to say a baby is alive, the baby is inside the womb, there must be cardiac activity. So there's what is called SA node. That SA node, it triggers electrical action. So that electrical activity of the heart is what that ECG monitors.
So it tries to monitor
so,
it.
There you can see some abnormal one.
Right.
Some their own maybe some, you know, while other people move normal. Some people own everything jaka.
All right, Chris Igbadia on Facebook is asking, I suspect I am having a partial stroke. I mean, a stroke. I wonder what you mean by partial. Do we have a situation where the whole body is immobile?
No, the partial stroke, they may mean partial stroke or mini stroke. We are talking about. In mini stroke, people recover within 24 hours.
Okay. So that's what they call partial stroke.
Maybe, but the one that they may have one leg or one, they also saw it's partial because they're splitting the entire body.
And anyways, he said, I suspect I'm having a partial stroke, which I have done several tests after I discovered I have a BP. Now I have something like a pepperish feeling on my left foot and my left palm and mouth. I need permanent solutions to it, sir. Thanks, and God will continue to bless you in Jesus' name. And I say amen.
Well, the issue also for that pepperish experience, he also should look at his own blood sugar. because more or less the diabetes causes neuropathy, which is associated with that. But as earlier said, it's not all I was being positioned to say on radio. Go to hospital. This is most critical. And don't not be in position to sweep your health matters under carpet and say, let me go and come back.
All right, then Joseph Eze is saying, good morning, Doc. Please, I'm calling from Delta, or you texted actually. I just woke up 2 weeks ago, discovered body weakness. I fell down twice as I struggled to stand. I am recovering as my right leg and hand. Okay, I am speaking well. How do I improve faster, doctor? Thanks.
Yeah, it's a stroke he has.
Yeah, and he's saying he's in recovering. How does he recover faster?
The faster, there's no miraculous recovery. That's what we are coming here. There's no miraculous recovery. He should continue that exercise, so he'll be able to help.
All right then. There are a lot of messages not related to what we're talking about. Maybe you would take out time to, look at them later. Okay, I'll take one or two more calls, and then Doctor, I'll raise an issue with you right now. Just let me take one or two more calls now. 95.1 FM. Hello. Yes, good morning. What's your name? Where are you calling in from?
Good morning. I'm calling from Bile. My name is Pep.
Bile, calling from Bile. Pep, welcome.
Thank you. Doctor, thank you very much for this great enlightenment you're giving to the public. You have talked a lot, and I want to. Is it only high BP that can cause stroke? What about a low BP? That just classify it.
When they use the word low BP, but before the BP start going low, something is already going wrong in the system, which of course is something that you may need to be in the hospital to be able to ascertain what is really going wrong there. But some people say my BP is low. Maybe their natural BP. There are some women that their BP is 150 and 90-50. That is their natural BP. Do you understand what I mean? So it's not that their BP is low by reason of accidental finding. But if there is a chronic illness for which the BP is going down, that's at that point the cause of it should be traced and then be addressed.
All right. Someone is asking, how much does it cost to do the ECG?
I think the ECG is it's not expensive, about 7,000 naira. But if the DrSaveAlife also make 50% of it because of the issue of sustainability.
All right.
For people that will be doing it and all that, to be able to keep them on.
All right then. Okay, I'm going to take one more call and then we will branch to another conversation now. Yeah. 95.1 FM. What's your name? Charles, welcome.
I'm calling from the campus.
Charles, welcome once again.
I wish that for some time now I've been having these pains all over my chest, my back region, and around my waist. So I've gone for checkup and they did some tests. They say it's H. pylori. And I've been taking the medication, the drug they gave to me for over 10 days now, but it seems the symptoms are not improving.
Okay. The truth of the matter is that H. pylori, it can just give you a telltale sign. But to be able to confirm that you have ulcer, you do what is called endoscopy, a camera that goes through your mouth to be able to find out what is going on there. And when it gets in there, a lot of things are inside that very pipe. It could be a problem of esophagitis. It could be what is called hiatus hernia. It could also be a reflux disease. It could also be from gastritis or gastric ulcer or what, so many of them. So I will be in position to suggest you get the endoscopy done, and if it is found, there's also drugs that can help to heal heal the ulcer.
All right, then. Thank you very much. This person is asking, Doctor, good morning, is back pain also part of symptoms of heart attack? He's saying caused by, he's asking.
Go to hospital. It's not something we'll be able to rule out here.
Aregbo Immanuel says, Dr. DrSaveAlife, thank you so much. Presently, I am feeling as if something is always blocking my chest. I tried always drinking water if it will clear, but still feeling the same. What do I do?
The summary of our discussion in this very subject is that people should make it a routine to go for health check.
Yeah, all right.
And it's interesting to point out also that aging without going for health check is like driving a car without dashboard. Whatever happens.
But Doc, you know a lot of people drive cars in Nigeria without a dashboard. But let's leave that one. Talking about driving without a dashboard, our health system seem to be driving without a dashboard, because currently,
honestly, that's the right word.
Our doctors are on strike, and they have brought out the reasons why they are on strike. They have said, oh, see, this and these and these and these are not available. About 15 reasons why, they have embarked on the strike. And the government, whether at the federal level or the state level, is coming out to say, hey, you don't go to work, you don't get to chop. You get, there no work, no, or at the workshop now, no work, no shop. Yeah. So that's what is happening. But really, I want to get your take on what is happening in our health sector. What do you think really are the issues?
Actually, if I should open up here to tell you about the healthcare system in Nigeria, it will apparently be that some people may take it in different contexts, but the truth has to be told at a particular time. Nigeria healthcare system is not just comatose, it is dead. I use that very word. It's not comatose. It's a system that the foundation is corrupt.
All right.
People will watch the situation where you have the doctors go on strike today, you have this other person go on strike. It's a cyclic event that will know no end. It's a cyclic event that will know no end. And the reason why our public healthcare system may never work in this country because the foundation is faulty. Now, I'm a medical doctor, and somebody will hear me now. I say, because he's trying to talk about the doctors, I want to be as plain and as unbiased as possible here. Now, what you see the doctors demanding is a replica or a reflection of how we value our own health. If the doctors are asking issue that has to do with the payment on the allowance on their hazards and all that, some have been owed for several months and all that. But if you recall that when it has to do with who should be given priority in life, you should be able to consider that the doctor should be given priority. Why? A doctor that has a family problem can kill you.
Interesting.
Honestly, I'm just telling you, why pilots are paid more. You remember the case of the German wing, this Lufthansa brand of that the pilot got depressed and went up there and crash land the plane. Do you understand me? And left the note of how he was so depressed of life and all that. That's why they are being paid, because they are managing human lives. And a doctor will be in position where he's having bills to pay and all that. And nobody, if he asks that this payment should be made just for the sake of hazard allowance, it will become known that should not be. Yeah. And unfortunately, let me put it to you, because we don't value our health, that's why the doctors on strike right now, everybody is calm. But if nobody's feeling it. But if it is something that people make a value of their health, they will know the number of people that have died. In the course of this, that somebody will have, look at the COVID period, that people will say having pockets of that here and there. And such people now can be managed. But where are the people to attend to them? They are not there. Now, I give you an instance. Government usually go to build hospitals. You build massive hospital, you buy equipment. But it is not the equipment that is important. I give, for instance, through the help of CBN and also Access Bank, we invested on the first digital cath lab in Nigeria, 900 million. Yeah. Now, that particular equipment is a radiation bound, because it has to be, say, high profile radiation equipment also. The doctor that will be behind that machine is as important as
the machine.
As the machine itself.
All right.
Do you understand me? But now we be in position and say, I will not pay this very doctor who is exposed to this radiation in the course of doing this very procedure. because he's supposed to be doing the work.
Right.
But I tell you where the problem of healthcare of Nigeria begins. It starts from the fact that the foundation is wrong.
Right.
Everyone in the system of healthcare, if they're making a demand right now, as soon as that demand is met, the other segment of the hospital, the other paramedics may also go on strike. So it becomes a cyclic thing, because everybody in the healthcare is fighting a doctor. If a doctor gets this now, I'm telling you, let them come back from any demand. It may not take a very long while. You will see another set of people go on strike again. Right. So it is something that the system itself need to be completely reviewed. Right. The Minister of Health will have nothing to do, because he has already said, no, we can't even help out. He's talking the truth. He can't help out, because if he, as they're answering to doctors now, the other people are also waiting. Right. So let us know what they are answering doctors.
So we know what we are demanding.
So we also know our own demand. So they are in between the devil and the deep blue sea. If I answer these people, what will be the fate of these people? But I am of the opinion that it will be necessary for government to review the entire foundation of healthcare system. Do you know that in Inewi, to tell you how bad the situation is, in Inewi Teaching Hospital, a doctor is meant to, a maid used to go to help the assistant, the nurses and the doctor, and the association of the maids that covers the maids in the teaching hospital told the maids not to be in position to carry blood for the doctors, that the doctor should go to the lab himself to go and sign out the blood and come to the to give the patient. So the maid is not trained, and that is what the situation is, because whatever a doctor is getting, the doctor should be. So it's a crisis, serious one, serious crisis. So this foundation need to be addressed. Otherwise, it will be from one strike to the other strike. And unfortunate thing that will happen in this country, that it may not be the next 5 years maximum. You will look for doctors in this country.
Because almost everybody is jetting out.
Oh yes, they say no, we will employ. In all honesty, let them ask for employment us now. You will be very difficult for you to see people apply for it.
All right then. All right, but we have you here, at today 95.1 FM, so we're happy. We have you here. All right, this message on WhatsApp says, "Good morning, Doc. My child is 1 year, 11 months old, but his frontlets is not yet covered. I've taken him to the hospital, but they didn't."
The what?
The frontlets. I don't know. I think the part.
It takes about 18 months, as I pointed out.
But it's now saying 1 year, 11 months. That's about 23 months.
Give him a little time.
She should give him a little time. All right then. There's still more messages. This one says, "My husband's pulse is always 50 BPM. Please, is that normal?"
Yeah, less than 60 is what we call bradycardia. That should be in position to be properly evaluated. So if it becomes so severe, that very person can benefit from what is called what is called a single chamber pacemaker. Single chamber pacemaker. Yes, you'll be able to build up the heart rate to